for our Create Conversations today. My name is Jenny Elliott and I will be moderating the discussion. Today's event is part of a series of conversations organised by the charity Create, which works to bring the creative arts to those who are most in need. This is Creativity and Wellbeing Week, as we all know, and that is precisely the topic of our discussion today. We will be looking at why creativity is essential to health and well-being and how best to ensure that everyone who needs it has access to the creative arts. A huge challenge. So to enlighten us, we have a panel of experts, which I want to welcome here today. So you're all very welcome, with different insights and perspectives on this topic. So it'll be a very interesting conversation. I will first say a few words about my own self. So my name is Jenny Elliott. I have worked in the arts and health sector for over 35 years. I trained originally as a healthcare professional, ran away to then follow my passion and train in contemporary dance, combined the two together and brought back into healthcare again, and have been working in the sector across arts, education and health, as I say, for over 35 years. I'm the former Chief Executive of Arts Care Northern Ireland, and in 2022 I started my own consultancy, Jenny Elliott International Arts and Health Collective. So I'm going to hand over now to the panel, and I'm going to ask you, Nikki, maybe to introduce yourself first as the Chief Executive of Create. Thank you.
Thanks, Jenny, and welcome everybody. It's so great to be here. I'm Nikki. I'm the founding Chief Executive of Create, and we're a leading creative arts charity in the UK. Alongside that, I'm a childline counsellor and I'm the trustee of two other organisations, including Wales Millennium Centre in Cardiff. Thank you.
I'm Dr. Jess and I'm a Senior Research Fellow at University College London, and my research focuses on arts and cultural engagement in the general population, so looking at what factors predict whether people do these activities and also the health and well-being implications of engaging in arts and creative activities.
Thanks, Annie. Hi, everyone. My name is Ioannis Bakolis. I am a Deputy Director of the Centre for Mental Health Policy and Evaluation at the Institute of Psychiatry, Psychology and Neuroscience at King's College London. I'm a Professor of Public Mental Health and Statistics and co-investigator and evaluation implementation lead of a program that I'm going to discuss today around scaling up health arts programs, which was funded by the Wellcome Trust.
Okay, so we're going to start our lovely conversation now, and we hopefully this will really bring some fabulous enlightenment to the wonderful field and the growing sector of arts, health and well-being. All right, so the first question that we're going to throw out to our panel this afternoon is, why are creativity and the arts essential to health and well-being?
Yeah, thank you, Jenny. I mean, here at Create, we believe that that people need to create. Creativity is not a nice to have, it's a fundamental need and right for every single human being. Every day in our work, we see the kind of profound impact of creativity on people's well-being, on bringing people together, on joy and inspiration, giving people a chance to kind of explore new things and try new things and see who they are. We did a nationwide survey in 2023 with Jacksons of Yorkshire, and even as someone who runs a creative arts charity, I was really amazed that 93% of people in the survey said that creativity is important to their well-being, and 84% of people in the survey said that they would like to be more artistic. I think what was really kind of profound for me, though, was that 27% of people said that they couldn't afford to take part in the creative activities that they wanted to because of cost. And when I set Create up 22 years ago, that was really at the heart of the charity, to provide free creative activities for those who need them most.
Thank you very much, Nikki. I think one of the things that stands out for me in that, and probably for the audience too, is just the importance and significance of you as an organisation offering your workshops and your activities for free. That is, that is something that will hopefully come through the conversation as we deliver that, because funding then rests on your shoulder as an organisation to actually bring that in and then be able to provide that, which is fantastic. So I'm going to move on to you, Jess, now, just really so that we're bringing you from the perspective of research into it and what you've been doing that's really interesting to share with us as well.
So my team here at UCL have been doing loads of work looking exactly this question. So why are creativity and the arts essential to health and well-being? And back in 2019, the World Health Organization asked us to do a review of the literature on this question. And we found, even then, nearly 6 years ago now, there were over 3,000 studies looking at arts and health and well-being. And we found across these studies that there is a huge amount of evidence that the arts can help to promote good health, to prevent illness, and to help in the treatment and prevention of chronic conditions across the lifespan. And kind of delving into that more, we've done another review since then, thinking about what are the potential mechanisms that could be underlying this. So how is it that creativity and the arts are actually benefiting health and well-being? And again, in that, we did a big review of the literature, and we found that there are over 600 different mechanisms that have been proposed that might link arts and creative activities to this whole range of health outcomes. And these can be like psychological factors, social, biological, behavioural, so a whole range of different things that might help arts and creative activities to improve health and well-being.
I think when we were having the conversation the other day, Jess, I did ask you to highlight what you think was the most significant outcome of all the experience that you have in your research. And you're talking across a wide range of reviews that you've done, which is, is fabulous. So what for you has been the convincing factor for you that the arts and health need investment and we need to embed it deep within health and social care?
Yeah, great question. So alongside these reviews, we've been doing lots of research ourselves, so focusing on a whole range of different outcomes among different age groups in the population, so older adults, young people, working age adults, and we've seen lots of evidence with a whole range of different outcomes. But I think the most convincing one for me is that in older adults, we even see a link between doing cultural activities with mortality. So people who do arts and cultural activities, even as little as 1 to 2 times a year, seem to live longer, with kind of larger effects for people who do those activities more frequently. And we found this in the UK, but it's also been replicated by other teams in the US and in Scandinavian countries as well. So I think that's a really convincing finding.
No, it's so powerful, and really there's no denying, if you look for investment and you're bringing forth, such a powerful outcome, particularly for older people and their quality of life and everything that is connected to their engagement with their creativity and participatory arts. There is every argument there that we need to invest our funds in older people and right across the board. So Jess, that's so interesting, and for the audience just to look into the work that Jess has been doing, because it has a wide scope, and definitely looking internationally as well, Jess, which is very important here in the UK as we link across with our partners. So we'll just move on now to, unless Ioannis, do you have anything that you want to say and add to that?
Yes, thank you very much, Jenny. Just to say that taking this evidence collectively, what just mentioned around the WHO report that took place in the 2019, but emerging reports that came through that period, I think it's paramount to highlight that there is arts is not only improving well-being and mortality or morbidity of the population, but we see that they are effective for a plethora of physical, social, and psychological problems which are across the lifespan. And I think it's paramount, and it requires to be linked with the wider kind of social prescribing programs, and that they're taking place, and there has been a major investment within the UK then, and be embedded within the NHS long-term plan, because although we have enough of evidence to claim that we have effective early health interventions, we are still lacking evidence on the implementation of these programs, of how much embedded are within the clinical pathways, and how much in scale they take place. Because what we are visioning is that we are seeing these programs taking place in small geographical areas, with small pockets of money, with unclear clinical referrals. So needs a lot of work around the adaptation around health and social care systems.
Mm-hmm. Those are really vital points, really, Ioannis, that you're bringing up. And it's that idea really of scale and growth. Whenever we have the evidence that is there, how do we get that investment to actually for it to have wider application? And I think really my own knowledge of the sector really is that there is so much going across in the UK that is brilliant practice, great delivery, but yet we need to have it scaled up and we need to have it accessed further with further outreach. So thank you very much for that, for your contributions to that question. Now we're going to move on to the next question now, really, that we're going to discuss this afternoon. What are the most promising developments and findings relating to wellbeing and the arts? And we're going to look in particular at work that Ioannis has been doing, the Shaper research programme. And then, Jess, we're going to discuss with you some of your interesting findings and implications of your research. So Ioannis, if I go over to you first to tell us about your Shaper research or anything else that you want to contribute to that, that would be brilliant. Thank you.
Thank you very much. Genders is a part of a very big team that was spanning from different organizations, such as the Breathe organization within South London, such as the English National Ballet, and Rosetta Life, as well as with academic institutions spanning from King's College London, where I'm based, in UCL. So Shaper was a program funded by the Wellcome Trust about scaling up health arts programs. It involved 3 different programs which we assessed the clinical implementation cost effectiveness of 3 arts in health interventions. One intervention, it was called Melody for Moms, was around singing groups for women with postnatal depression. And one other intervention was in collaboration with English National Ballet for people with Parkinson's disease. And the third intervention was called Brain Out Disease, and was about performance art in people that had a stroke or a brain injury throughout their life. So, I mean, as a spoiler, we are still crunching the data, but we found some preliminary findings show that both of the 3 programs have provided some clinical effectiveness and some reduction of the clinical symptoms that we were aiming at. But our primary aim, our major aim of the Shaper program was how we can integrate these 3 health, art and health programs within clinical referral pathways within, for example, King's College London Health Partners, but across as well London and across the UK. And we would like also to show how we can enhance arts and well-being in larger cohorts of people.
Thank you very much. That is incredibly, the one thing that comes across, which from my perspective in working and being a chief executive or former chief executive, was always the cost effectiveness. And I think really from the outset of looking at the research in arts and health many years ago when it sort of really initiated, the big question around the healthcare trust in Northern Ireland for us was like the cost effectiveness. Can you prove to us? Can you prove? Can you prove? So it's interesting that that cost effectiveness is now being integrated very much and is delivering the answers, you know. And also those significant 3 projects, the National Ballet and also the brain injury and the singing project, you know, all very different projects, but also equally coming out with very strong outcomes there. Anybody in the panel want to make an extra little comment on that?
I think this research is so important. I mean, we don't actually work with people with postnatal depression, but we do work on the ground. We work in psychiatric hospitals, in adolescent units, and we've seen, for example, we took a ceramicist into a hospital, and we were working with a group of young people who were all experiencing kind of extreme mental health conditions. And the thing which really struck me when I went into the unit was seeing that every single young person had self-harm marks on their wrists. And for me, it was like a real outward sign of an inner pain that they had no other way perhaps of expressing. And there was one young woman on the project who worked on a ceramic piece, and at the end of the day we invited her and the other participants to place their pieces on a drying table ahead of painting the following day. And what struck me, I mean, if I had over the 22 years that I've run Create, if I needed a single piece of work to demonstrate why everyone should be given the opportunity to be creative and to have a way of self-expression, it would be this piece, because this ceramic bust, it had a furrowed brow and a tear, and then where the mouth would have been, there was just a huge cross, and it just gave such a strong kind of indication of, I feel I have absolutely no voice. And I know that that piece and the message that that piece gave really helped the staff within the hospital unit to kind of work individually with that young woman up, beyond our project. But it also gave her such a strong way of being able to say something that was kind of so inside her that she, hadn't found another way of expressing except through self-harming.
Yeah, and that's a really good example of the power of change and support, particularly amongst younger people. So Jess, if we go across to you now and you would like to tell us a little bit just about the research and your interesting findings and the implications, which is always the big part of it as well. Thank you, Jess.
Yeah, so I think what we've talked about already kind of demonstrates really nicely how important it is that we have the evidence at these different levels. So from Nikki, we hear people's kind of individual stories, and you hear the real kind of individual level impact, and you can see what is happening when people do these activities. And then from Ioannis, we can hear about the particular interventions that are targeted at people, specific groups of people who've had particular experiences or have specific disorders. And then kind of right up at the other end is my work looking in the kind of general population. So saying for people who are doing these kinds of activities in their everyday life, not as a kind of targeted intervention, but just as part of their, hobbies or their leisure activities, looking at whether that also benefits their health. And as I've kind of touched on already, we do really see evidence across a range of different health outcomes. So from kind of mental health, through to mortality, through to frailty in older adults. So a whole range of different kind of evidence there that I think is really, really important to bring together across the different levels and kind of provide these arguments to raise the awareness of the impacts of the arts for health.
And can I just ask you quite a personal question, Jess, maybe at this point, is why were you drawn into searching for evidence from the arts and health perspective? What was it that excited you or inspired you to do that?
Well, I think it's really interesting. So a lot of us obviously do these kinds of activities in our everyday lives. I love going to gigs and festivals, but kind of providing this evidence at the kind of population level, as I try to do, is really, really difficult. It's a very challenging kind of area because we know that there is a big social gradient in who gets to access these activities. As we kind of touched on already, there are a lot of barriers to people being able to access arts and culture. And a lot of those kinds of barriers are very similar to the inequalities that we see in health and mental health outcomes. So it's really, really hard in this area of research to tease those things apart and actually show that these activities are benefiting this whole range of health outcomes, even after we've accounted for all of those other kind of social factors. So for me, that is a really, really interesting part of this work and really important to account for properly. And that's the kind of direction we're trying to move in.
Thank you for sharing that. That's just a lovely insight into a researcher's journey, really. We've had a couple of questions actually, and one of the questions is, did the WHO report define creativity, or was it limited to visual arts or across all arts activities? Anyone in the panel want to take that question for us, please?
Yeah, I can take that. So that report kept arts activities really broad. So it was looking across a whole range of different arts activities for kind of all of the evidence on what different arts interventions, what benefits they can have for a range of health outcomes. Because it was the first kind of report of its kind, the idea was to try and keep it as broad as possible and look at everything that we could, which is why there were so many studies to include in it.
Great, thank you for answering that. Let's go on now to just the next question that we are going to be looking at. How do we raise awareness and put this higher on the agenda in society? whenever you're like Nikki, working on an everyday basis, making things happen, it is very difficult to actually raise awareness, to have the resources within the size of our teams when we're working on it on a daily basis, how to bring it into this higher agenda in society. Where do we tie in with the research evidence that's going to change policy and bring it right into the heart of government and get it truly embedded? So we're going to start actually asking you the question, Nikki. How do we raise awareness and put this higher on the agenda in society?
Yeah, I mean, it's such a good question, and it's very difficult to answer this question without being very political, which I really don't want to be. But I mean, the reality is that the creative arts have been absolutely underfunded and undervalued. I think if we look at what's happened in schools where the creative arts have been kind of ripped out of the curriculum, if we look at our universities, there are endless creative arts courses that are closing, and there's kind of a sense of, if you want a kind of a proper job, you don't go into the creative industries. But that's really balanced by a time, with kind of the development of AI, where creativity, I mean, it's been identified as the World Economic Forum as the second most important skill for business. The creative industries contribute an estimated 124 billion to the economy. And yet a fantastic report that was brought up by the Campaign for the Arts and the University of Warwick last year showed that contribution to the budget to the arts have been decreased by 6% at a time where countries like Germany, France and Finland have increased these budgets by 70%. I mean, I guess put simply, we need more investment in the arts, and every single person deserves to have access.
And why do you think they just don't get it? We have all this evidence that is there, and and still we are knocking on doors. The stress level for organisations and smaller organisations who, as you say, Nikki, their finances are being cut. We're showcasing our work. We're providing the reports for it. Everybody's recognising. Everybody says, it's great. Evidence is there. But why are we not just getting that so much here in the UK compared to perhaps other countries that are getting it and are investing more?
This doesn't really explain the kind of cross-country differences, but I do think that there is generally kind of a perception that the arts are something that's nice to have, but it's maybe not kind of necessary for our health and well-being. Obviously, within this room, we might be thinking differently, but just kind of in the general population, among policymakers, among kind of in medical education, that, we see these things like exercise and good nutrition and sleep all being framed as health behaviours, but we don't see arts in the same way. So we as a research group have actually been starting to think about, well, we should be framing the arts as a health behaviour. We should be putting it alongside things like exercise and sleep, and setting kind of targets for people to have kind of typical levels of engagement. And we should be monitoring it as well at the kind of country level to see what are the trends of engagement. Are they increasing? If they're decreasing, what do we need to do? So I think that's kind of one option we could go down.
No, thank you, Jess. That's great. And again, that's, it's a thought that is opened into the audience of other people's experiences and how we can really raise this awareness and how we can get it into policy. Ioannis, I'm going to go across to you just to have your thoughts on this and expertise really from generating fabulous evidence. So, yes.
The important bit is like to have a multi-layered approach. So we need to really consider, in order these programs to be effective and to be able to raise awareness on that, is like to really need to think which are the different stakeholders around this, which are the people who are receiving the interventions, which are the people who are commissioning the intervention, and which are the people that they are actually delivering the interventions, the actors themselves. So I think what we're actually seeing from our research is that when you try to conduct a multi-layer approach, you can improve a little bit the impact and the awareness on these programs. I mean, rigorous research is needed. Obviously, we need to create evidence-based policy up to a certain extent. And, cost effectiveness analysis and health economics is good, if you want to discuss about commissioners, or you want to go to the National Institute of Clinical Excellence and form a policy around this. But we need to have a combination, for example, of personal stories, which can couple within the data and the evidence that we are creating of that. And I think, for example, I mean, like coming back, like when we were doing the qualitative interviews around the SAPER program, for example, a lot of people with Parkinson will not engage to the program from the very beginning because they thought that, for example, ballet was an elite art. So there is a stigma surrounding as well some of the specific components that are related to art, and how we frame the question, not only as a health behavior, but how we break these barriers, or how we improve the facilitators around implementing these programs is very important. And I think it's important when we're thinking about arts and health to think like communities, like we need to design all this embedded within what the people that they've been on the receiving end, and be from the early start when we're designing that. And that comes as well, like to the people that they will actually probably funding or commission it as well. So I'm not saying something like groundbreaking, but we need to have an early buy-in from all the different elements of the people that they're delivering these interventions.
Yeah. And I think that's a very important thing, is that it is a buy-in from everyone, really, and that's where the strength lies in it. And I think it's all down as well to the relationship building, the partnership building. I was having a conversation the other day, is relationship building more important than partnership building? Or are they equal, really? And what is the difference? But often in the work that I would be involved in, when you invite your funders or potential funders to come and to see live art in the making performance or our exhibitions or the showcasing is a very critical part. And when they see it live, that is the voice of the people that are involving and the service users and the clients and the people who are making the art. And that's when the voice is at its strongest, whenever our funders come along to see it. So, and we've had great support in Northern Ireland from our funders, from the Arts Council down through Department of Health, etc., supporting us in public health. Right. It's just, Mavis, you've just made a comment really about NUM, or an agreement to it being embedded, the arts being embedded in NUM, and have agreed to take it and embed it into their MH strategy, which is fabulous for adults. And it's also going to CYP Commissioning Board for a conversation. It is still hard to convince despite evidencing. And I think that is the experience of all of us who are here promoting and working in the arts and health. How do you shift, is another question you're asking, how do you actually influence and shift the cultural normality to choose the medical model? Or I suppose my question is, has it to be a medical model, or as a choreographer, can we dance the arts and the medical model together to make a fabulous new model that is very multi-layered? So anybody that has any thoughts on that in the panel?
I think that it's challenging because kind of commissioners, policymakers do work with this medical model. That is currently how our health services are run. So kind of regardless of whether we think that is how the art should be kind of approached, to embed the arts within health services, we do to some extent have to work towards that model. So we do have to provide this kind of robust evidence showing that there is a real kind of causal effect of doing these arts activities on health outcomes. And this is where, as we've said a few times already, like providing this evidence at the different levels is really, really important. But it's also where it's really important to bring in that health economics. So showing that these activities are cost effective and that they can bring money to the UK economy, but also they can create cost savings in healthcare. So where we're kind of evaluating these arts interventions in healthcare settings, it's really important that we're not just looking at health outcomes, but also that we're trying to do cost benefit analysis to show that, okay, by introducing these arts interventions, we are saving X amount in other care, or by improving wellbeing. So I think that is something that's challenging to do, because you need big samples to do it, you need validated measures. So a lot of the work that's been done in the area so far hasn't been able to do it. But I think that is a really big next step for us working in the field.
Thank you very much, Jess. and hopefully that will raise some more questions, because this is what this conversation is about, that we raise more questions and we inspire and get some more answers, and that we promote the arts in health. I also now we're going to move on to the next question. And this is a really big question for all of us. How can we expand access to the arts to those who truly need it? And it's identifying, really, from my perspective of working, it's how we reach marginalised communities, how we reach the most in need, and how do we expand that? How do we make that happen? And there's a lot of effort that goes into it from organisations, as Nikki will know, in trying to make that access happen, and all the infrastructure that is built in around it to make it safe, and all the other aspects of developing such programs. So how can we expand it? I'm going to go to you, Nikki, first of all, on that question, if you would like to comment.
Yeah, thanks, Jenny. And also, I mean, just backing up what you said, Jess, a moment ago about kind of evaluation. I mean, I think at Create, we really rigorously evaluate all our programs, you know, through getting feedback from our participants, our partner organisations, our artists. It's not done in the same way that you at universities do it, but we constantly collect quantitative and qualitative feedback so that we can really demonstrate what the difference that we're making through our programs. And I think kind of thinking about how we expand access to the arts, I think the single most important thing that we've done at Create is that every single project that we deliver is free to every participant. And that means that it takes away the kind of money barrier, you know, the 27% of people who say they can't afford to be creative. And we're working with some of the most kind of isolated and vulnerable participants across the UK. So if we're working with, say, young carers or children in care or isolated older people, they all access our projects for free. I think alongside that, there are other things that we've done that make kind of beyond cost, that make sure that our programs are accessible. So we co-create every project with our partner, whether that's a prison or an older people's organisation or a day centre. And our participants' voices come through, so we know what our participants are interested in, what they want to do, so that projects are really created to meet their needs. We make sure that we're bringing in equipment that is fully accessible. So we have, for example, music equipment that can be adapted, for example, for somebody who has a particular type of a disability, so that, you know, all our participants can access the equipment we bring in. It's really important for our participants to feel kind of warm and comfortable and safe in the venues. And of course, making sure that venues are fully accessible. Those are kind of just the kind of basic building blocks of any project. And I think one of the things that came out of COVID for us when we developed our what we call Create Live, which was our pivoted Zoom delivery, what we found is that being able to offer projects over Zoom has meant on an ongoing basis that people who are unable to leave home, maybe because of access needs, or because they're caring for somebody, or because of a lack of kind of geographical access to activities, we now can go into their homes. And so that has made a huge difference. We can deliver into someone's home a fantastic project completely free of charge.
I know it's amazing what COVID, the impact COVID has had, whenever we all had to respond so quickly and train our artists up, the workforce up, and the health and social care staff as well, just to get right in there and to start working around the world of Zoom that has sustained. And we're now at a stage, I suppose, when we reflect on that, maybe it's not just the outreach now hasn't been so much through Zoom as it was during COVID, but there's still a very strong role for it. Ioannis, I'm just going to go to you just to have your reflection on this question. How can we expand access to the arts and to those who truly need it? You know, what can you do for us as a researcher on that evidence to really make an impact and see how we could expand that access?
Thank you very much. I think, I mean, like we discussed today, we're talking about arts that is something, like holistic or one, or, like as a bundle of things. What I mean, it's arts and health intervention. It's intervention something very specific. It could be very local. It could tailor to specific population. And I think this links, like a little bit with what we said within to think a little bit more creatively, how we are evaluating these interventions, how we are discussing the participants of this intervention, of the people that they are delivering this intervention, how we move a little bit away from the medical model and make it more tailor specific and more context specific as well. So that's important things. And we know that, especially because I'm a mental health researcher as well, public mental health researcher, we've seen that in other fields that there needs a change of language as well to engage specific communities. And in order to make your interventions adaptable to different kind of cultural and geographical context, again, they need to think a little bit what Nikki said, because Nikki, I think what I really liked is like we didn't discuss only about underrepresented populations, but discussed a little bit more about the active ingredients that we need to make these programs successful. For example, like who are receiving those interventions? Are these feasible, acceptable, appropriate for them? How hard it is to reach this specific population? What is the context around and the environment we have to do it? What do we need to consider for people delivering this information? Do they have appropriate training? How the artist feels about this? Is this something they can embed within the clinicians? Is this something that they can embed within their actual everyday life? And how equitable it is for all? Does it mean that we need to set up these programs within underreserved populations or to kind of more deprived geographical areas? Do we need to move remotely? We need to consider all these kind of important elements, not only kind of a one solution for all, but building it to the local geographical, like smaller context of what we were describing today. And that will help us of how we can implement and rule future strategies around arts and health intervention.
Thank you, Ioannis. Yes, I suppose it's that idea of how you do and deliver bespoke projects really for smaller communities. And then, and there's a lot of investment and a lot of work, as we know, Nikki, whenever we are doing that, and you're doing that on a daily basis. And then how you scale that up, and then how you build a model of, again, getting the evidence together. So it does, all of this is very much about community. It's about people come together, partners, relationships happening between research practitioners, organizations, families and communities. And I have to say that some of the best research that we have brought in, really, well, I have in terms of my work, has been from families in the communities, that community buy-in is very significant, and their voices can be very powerful whenever they want to bring their voices forward. We have very little time left, but I just want to throw some thoughts that the audience have been having here. And we've had one there. Is there an image of this medical model that we can see? And just saying that we're here today to start a conversation. There are many layers that we have not even touched on. One of the big ones is the creative workforce, who delivers this work, the support of our artists, how we bring them through, how we use education for arts and health professionals. There is just a whole lot of conversation around that too. So other thoughts that have been thrown in: what type of qualitative and quantitative analysis do you recommend for measuring impact in a small cultural industry?
I can have a go. I mean, like, I think I think we definitely what we're seeing. I mean, like in general, when we're talking about this kind of public mental health interventions, and like when it comes to mental health, but I think this applies to physical health, of course, also, is that we need a kind of a combination of approaches for sure. So I don't know exactly. I mean, like it's very tailor specific to what you're aiming to do and which one is your population, in order to see what are the appropriate metrics to do that, or which art intervention are you actually trying to measure and deliver. So, but definitely, I think a combination of qualitative interviews when we're thinking an evaluative perspective, an element of more like quantitative metrics, which could convince a little bit more, like people who are commissioning this, and some cost implications around this would definitely be be beneficial when we're thinking about how to evaluate these programs. But just to say that depending on how big or how small is the project, like sometimes just having the community there and the personal story might be a good startup point without having all this groundbreaking qualitative data as well.
I just want to maybe bring this to a close now by Nikki, going back to you. Can you tell us what is the gold nugget that you look for when you're engaging an artist to deliver inspiring creative work on your projects?
I mean, it is such a great question. I mean, at the heart of what we deliver at Create is that every artist has to be a professional artist. So they have to work in their art form and be absolutely passionate about their art form, but also passionate and highly experienced at delivering projects in challenging community settings. So that's kind of at the heart, and they have to be very participant focused, as we talked about, kind of co-creating. We actually asked, we had a social value survey that we asked to lots of our stakeholders recently. And it was really interesting that our partner organisations identified really why the fact that our artists are professional artists was so important. They identified 5 things. They said that they identify and encourage talent among the participants. They demonstrate an absolute passion for their art form. They have extensive knowledge and expertise. They bring empathy and understanding, and they are a positive role model. So I guess in sum up, what am I looking for? I'm looking for passion, professionalism, and co-creation.
Fantastic, Nikki. Yes, absolutely. Love the passion in there. Yeah, and as someone who works in the arts and has worked in arts and health for years, we also want autonomy throughout arts and health for the arts to travel in some way free flow through our NHS with its magic and with the creativity as well. I'm just going to bring it now to a close, really, the meeting. And I want to say thank you to everyone who has in the audience has joined us today. It's been a very fascinating conversation. Have a lovely evening. And from my perspective, just keep on dancing, as they say.